Hey guys, Tony Maritato here, physical therapist. So a super common question is, do I use heat or do I use ice on my post-operative knee replacement? I hate to say this, but it really depends. So here's the thing. I've been in this profession about 18 years. I've been a licensed physical therapist about 12 years. In the beginning, if you ask me that question, this is exactly my response. I would say, because it's a long explanation, okay, you use ice, you never use heat. You use ice on acute injuries, you use heat on chronic injuries. Heat increases swelling. Heat will draw fluid into the area. Heat will cause the blood vessels to dilate. It's already hot, it's already swollen. We don't want to use heat. Don't listen to that, but that's what I used to say. I also used to say, ice is a vasoconstrictor. Ice will shrink the blood vessels. Ice will push the fluid out of the area. Ice will numb the area, numb the nerve endings, which reduces pain. And then when you remove the ice pack, the tissue will warm back up. The blood will return. It'll flush out the waste products. It'll improve fluid exchange and circulation. These are all things I said. Kind of true, not totally. But we didn't know, where did the idea of ice even come from? Now, I'm not against ice, and I'm going to tell you to put ice on. But I want you to understand the context and the history surrounding it. So before the early 1900s, we didn't have ice available 24 hours a day, 7 days a week. Ice was a modern invention, and my understanding, based on some research, is that an orthopedic surgeon who was on the football field or the sports field in the 40s needed something that was fast, cheap, and effective at minimizing pain and helping the athlete tolerate an injury. And so what they did was they found out that, hey, now we have refrigeration, we have ice 24/7, let's throw an ice pack on there, numb it up, and the athlete will feel better. And it worked, right? It's better than a pain med. But if you look at the research suggests there's no true clinical benefit to putting ice on an injury. The stuff that we used to think, so we used to say ice reduces swelling because it constricts the blood vessels. Now we understand that the swelling really is probably reduced because of the weight and the compression of the ice, not so much because of the cold itself. Yes, our skin is tolerant to bigger changes toward cold. In other words, if my 98-degree body, I could put a 32-degree ice pack on there, I get a big dose in change in temperature, but that doesn't necessarily mean anything clinically. And there's reason to believe that with a big, hot, swollen post-surgical knee, the coldness is never going to penetrate deep enough into the tissue to make any clinically significant change. Now, ice alters sensation. There's no question about that. And we know pain. We need to get into the topic of pain at some point in this group. But basically, we know that pain has a lot to do with sensation, how sensation is processed, whether the tissue is under threat. And so anything that changes sensation is going to modify and modulate how your pain response affects your body. So for some people, ice is the key. They love ice. They live for it. They think it's the best thing in the world. And if it helps them feel better, if it changes the sensation they have around the joint, and that allows them to walk more and get out of a chair and do more things, ice away. Use ice as much as you want. It's totally fine. If, however, you're one of those people who is sensitive to ice, who does not like ice, doesn't feel better with ice, don't feel bad. Don't force yourself to do it. Heat can be your friend. The same thing I said about ice, I'm going to say about heat. Heat is about altered sensation. The truth is, I cannot heat the skin enough without running the risk of burning the superficial layer of skin to penetrate deep enough into the joint, into the tissue. The knee is a big structure. There's lots of depth and lots of layers. So the best you can do is apply heat, dry or moist, on the surface of the area. It will feel nice, it will feel soothing and relaxing. If that makes you feel better and that allows you to get out of the chair and walk a little more, do a couple more exercises without a negative response, use the heat. But clinically, I want you to understand, there is no clinical difference between ice, heat, or nothing at all. If you were gonna take 10 to 15 minutes of time to do something, I'd rather you get up and move. That's the bottom line. So do whatever you do that helps you get moving, because that will improve the outcome. That will get you to your goals faster, and that's the honest recommendation that I'm going to give you today. So thanks for watching. Post your comments. Let me know what kinds of questions you guys have. I'll keep putting videos out as quickly as I can, but you guys are doing amazing, so keep up the great work. Thanks for watching.